Good afternoon. My name is Michaela Etheridge, and I'm a student nurse at the University of South Alabama College of Nursing. This is going to be my initiating an IV saline lock video. So the first thing that I'm going to do is verify my order, verify my hospital's policy, and gather all of my equipment that I'll be needing for today. Then I'm going to perform hand hygiene, and I'm going to go and verify that this is my patient using two identifiers, so Jaguar Jones, MR number 4176352, MR number 4176352, and we're going to go ahead and assess allergies. So we have allergy penicillin and allergy penicillin on the wristband, so they match up, and I would just ask him if he had any other allergies that I need to know about. Then I would explain the procedure to the patient and close a curtain or door to provide privacy. Then I'm going to position my trash can, perform hand hygiene, and don my goggles. Then I'm going to raise my bed to a working height and lower the side rail, and I'm going to position the patient in a comfortable position. And for this, they would probably want to be supine or just sitting up, whichever is most comfortable for them during this procedure. And now I'm going to get all of my sterile supplies on my bedside table, and I'm going to open my sterile packages. I'm going to open my sterile packages and organize on my bedside table. So the first thing I'm going to do is I'm going to open my saline lock. I'm going to remove my Tegaderm from the IV kit. I'm going to remove my saline, syringe, and my chlorhexidine swab. Then I'm going to swab my injection cap. So with an alcohol pad, I'm going to swab the injection cap on the saline lock tubing. And I'm going to attach my syringe. I'm going to prime. And I'm going to attach and prime the tubing as well. And then I'm going to replace it. I'm going to loosen the cap on the tubing so that it's easier to connect to the over the needle catheter. And then I'm going to place it back into its sterile package. So I place it back into its sterile package, and I'm now going to open my over the needle catheter and remove it from its packaging. And I'm going to remove my Tegaderm from its packaging. And then I'm just going to make sure that everything on my sterile field is still sterile and organized. And now I'm going to show you three principles for selecting a vein. So 3 principles for selecting a vein would be you're going to use the most distal site, you're going to use the non-dominant arm if possible, and you're going to choose the largest, softest, bounciest vein. And then 3 ways to foster venous distension would be lightly stroking the vein, it would be adding warmth to vasodilate for a few minutes, and it would be getting the patient to ball their hands into fists if they're able to, and if they're not, then they can just put their arm in a dependent position. Now that I have chosen my site and fostered venous distension, I'm going to add my tourniquet, which is also a way, and I'm going to apply it 4 to 6 inches above my selected site. And if I needed more, if I thought I was going to take too long with before inserting my IV, then I could just temporarily loosen the tourniquet. So now that I've done that, I'm going to perform hand hygiene, and I'm going to apply my clean gloves. So now that I have applied my clean gloves, I'm going to move my my saline lock sterile package closer to the end of the bedside table. And I'm going to now cleanse the site. So I'm going to cleanse my site with a chlorhexidine swab. I'm going to be using friction for at least 30 seconds, going vertically, horizontally, and in circular motions. So I'm going to make sure not to touch my site with my hands because that will cause contamination. So I'm going to go circular, vertically, and horizontally for at least 30 seconds. So I could just do each of those for 10 seconds, making sure that I go for at least 30 seconds. Then I'm going to allow it to completely dry. So I'm waiting for it to dry. And then I'm going to begin with inserting my IV. So to insert my IV, the first thing I'm going to do is anchor the vein. So to anchor the vein, I'm going to grab, I'm going to stretch the skin. I'm going to anchor 1.5 to 2 inches below the insertion site that I have chosen. And I'm going to stretch the skin in the opposite direction of the way I'm going to insert the needle. So I'm pulling down and I'm going to be inserting the needle in. And I'm going to make sure not to touch my cleansed site, insertion site with my hand, and make sure not to touch my anchoring thumb with my over-the-needle catheter. So I'm going to grab my over-the-needle catheter, and I'm going to remove the top. I'm going to insert with the bevel up. So I'm just going to tell my patient, all right, I need you to be very still for this, and you're going to feel a slight little stick, all right? So I'm going to insert with the bevel up parallel to the vein at a 10 to 30 degree angle, making sure that I go at that angle because if not, I could go through the vein. So I'm going to insert, making sure not to touch my anchoring thumb. So now that I've inserted, I'm going to assess for blood return. And once I see blood return, I'm going to lower the needle. And I'm going to insert another 1/4 of an inch parallel to the vein. And I'm going to, while still holding the skin, I'm going to move the hub all the way to the skin without advancing the stylet. I'm going to secure the catheter with this hand, and I'm going to pop the tourniquet. I'm going to put firm pressure, 1/4 of an inch, above the insertion site. I'm going to remove the stylet and place it into the sharps container. And I'm going to very quickly take the top off of my saline lock. And I'm going to quickly attach it at the hub of the needle. So now I'm going to temporarily tape my tubing. And I'm going to aspirate for blood return. So I'm going to aspirate for blood return. And then I'm going to flush the vein with the rest of my saline. And I'm going to observe the site for any swelling, and I do not see any. So now that I have inserted all my saline, I'm going to remove the syringe, and I'm going to place it into my sharps container. So now that I have done that, I'm going to apply my transparent dressing. So I'm going to get my Tegaderm, or transparent film. I'm going to open, making sure not to touch the underside, and only touch the part that I'm supposed to. And I'm going to place it above the hub, on the hub, making sure not to cover the connection site. And this, I'm just going to make sure that it is secure. So I'm just making sure that it's not covering the connection site and that it is secure. So now that I have applied the transparent dressing, I'm now going to remove the temporary tape, and I'm going to secure the IV and the IV tubing with my permanent tape. So I'm going to remove my temporary tape. I'm going to throw it away. I'm going to let this tubing assume a natural position, and then I'm just going to tape it down. And I'm going to make sure not to tape my transparent dressing. So I've secured my tape and let my tubing allow a natural position. And now I'm going to dispose of my equipment. And normally I would remove this, but I'm going to need it later for the removing. So I'm just going to leave it. And then I'm going to dispose of my gloves. So glove to glove and skin to skin. And since I do not have a label, I'm just going to tape with as a label. So I'm going to write my name, my initials, the date, the gauge of the needle, and the time. And then I'm going to attach that to the edge of my transparent dressing. So I have applied my label, and now I'm going to position my patient into a comfortable position. I'm going to raise the side rail and lower the bed all the way back down, and then I'm going to give my patient some pointers on how to prevent dislodging of the IV. And then I'm going to teach them the signs and symptoms of IV complications, which would be phlebitis, infiltration, and inflammation. And I would just tell them to come and alert me or call me or another nurse if they notice any blood on their dressing or in their tubing, or if they notice that their fluid is slowing down or just completely stops. And then I'm going to perform hand hygiene. I'm going to leave, and then I'm going to go document. So I'm going to document the date, the time. I'm going to describe the location that I inserted the IV, the number of attempts that it took, the catheter gauge and length, how the patient tolerated the procedure, and whether there was a presence of a saline lock, or the flow rate and method of infusion if there were any fluids. And so that's what I would document. And now I'm going to show you how to discontinue using aseptic techniques. So I would leave, come back, place a waterproof pad underneath my patient's arm. I'm going to perform hand hygiene, and I'm going to put on some clean gloves. So now I have on my gloves. I'm just going to move this a little closer so you can see. So now I'm going to discontinue the IV. So the first thing that I'm going to do is I'm going to remove the transparent dressing, the old transparent dressing, and I'm going to pull it towards the insertion site. And then I'm going to throw that away. I'm going to get a sterile gauze, and I'm going to place it right above the insertion site. So I'm going to hold it above the insertion site. I'm going to take off the tape, and now I'm going to remove the catheter. So I'm going to pull it out steadily and slowly with the hub parallel to the skin. So I'm just going to remove. I'm going to keep pressure on there, and I'm going to place it into my sharps container after I have checked the intactness of the catheter tip, of the catheter itself. So I'll check the intactness, place it in my sharps container, and I'm going to hold pressure on the site for at least 30 seconds, or if my patient was on anticoagulants, then I would make sure to hold it for 5 to 10 minutes with pressure. And I'm just going to check and see if it's still bleeding. And then I'm going to observe the site for any IV complications. So that would be redness, pain, tenderness, swelling, bleeding, or any drainage. So I'm going to check for all of that, and I do not see any. So I'm going to remove that old gauze. I'm going to get a new dry sterile gauze. I'm going to place it right on the insertion site, and I'm going to secure it with tape. And that is all for my IV video.